Good afternoon, all. This is Awais Sheikh, and we're so excited to have you all join us in our session here today. We have a wonderful panel here to talk about innovation in large corporations, intrapreneurship. Just to introduce the session, especially in these recent years, in the past 10 or so years, we hear so much about large companies wanting to infuse innovation into their corporations and adding innovation teams kind of as a corporate function. But we kind of want to do a pulse check on that and say, okay, well, how do these intrapreneurs navigate trying to be entrepreneurial and apply innovation in these large corporations? And so to help with that, we have a wonderful panel here with us that I'm going to have them introduce, Elianna, Starr, Erik, Johansson, and Wright. But first, my name is Awais Sheikh. I'll be your moderator for the session here today. And I am with Amazon Web Services, AWS, part of our strategic planning and execution function in our federal and nonprofit sector. And I recently joined there after supporting MITRE. MITRE is a nonprofit corporation that also works with our U.S. federal government. And in that role, I led our business innovation capability. And so I'm one of those folks that have tried to infuse innovation in kind of not just a large corporate setting, but also in the government setting, probably the biggest bureaucracy we can think of. And so I'm going to have the panelists each introduce themselves. I'm going to start with Elianna. If you want to go ahead and introduce yourself.
Hi, everyone. My name is Elianna Starr. I just want to thank you all for being here and having me here. And I hope you and your families are staying safe in these times of COVID, as well as fires out west. So I work at Visa. I've been at Visa for 8 years in a variety of roles, from mergers and acquisitions to corporate strategy to product management to client consulting. And my current role is I run strategy and operations for a North America innovation practice. And that really entails two pieces of the puzzle. One is internal product incubation and R&D, and then the other is innovation consulting with our clients. We also have a demo physical experience in our San Francisco and New York headquarters, which of course we're working on turning virtual now. So we also do what we call innovation evangelism and bring our clients and partners through our innovation experience in our locations.
Thanks so much, Elianna. That's awesome. Can't wait to hear more about what you guys are doing at Visa. Erik, do you want to go ahead and introduce yourself?
Sure, yeah. So my name is Erik Johansson. I am the Chief Innovation Officer at SEPTA, which is, for those of you who are not in Philadelphia, that's the public transit agency in Philadelphia. Pre-COVID, we served about 1 million customers a day, 5th largest transit agency in the country. So I've been at SEPTA for 10 years. I started in the finance department, working on strategic and sustainability planning. Then in 2015, we created the innovation function at SEPTA, and have really been on sort of an innovation journey for the last 5 years, which has culminated recently, actually, with the expansion of the innovation function at SEPTA to include a lot of data management practices and working with big data and data governance and data policy as sort of a key priority and a key focus for the innovation agenda moving forward at SEPTA. So really happy to be here.
Thanks, Erik. Yeah, that intersection of innovation and big data, it's really interested to hear about that perspective. Hopefully we'll have some time to touch on that. And last but certainly not least, Wright, if you want to go ahead and introduce yourself.
Absolutely. Good afternoon, everyone. So excited for this conversation. Looking forward to the discussion and sharing of ideas. This is amazing. So my journey really started with that very question that you were just talking about, Awais and Erik, and the opportunity to intersect data in a new way. So I'm an epidemiologist by training, thinking about the ways that technology and data can really transform health on a more population-based approach. And so through that work, I actually have taken it and tried to apply innovation, design, research, technology within the healthcare sector. So for me, my journey has taken, I've been in public health departments, I've been in hospital systems with clinical providers. currently, I serve as the AVP for Design and Innovation for Blue Cross Blue Shield of Texas, Illinois, Oklahoma, Montana, and New Mexico. All of those 5 plans are under the umbrella of Healthcare Services Corporation. And so I lead the Innovation Lab, which is a physical space, but also we'll talk more about what that means by way of function as well. So I have been there for the last 3.5, 4 years, and really looking forward to the discussion this afternoon. Thank you guys for having us today.
Thanks, Summer. And it's also cool hearing you even in your introductions. I mean, you're coming at this from different sectors, but you're all part of kind of large corporations. And all of you have, innovation in your title or as part of what you do. So I actually want to start there. I have a few questions I'll start with, and then I encourage all the participants, go ahead and send your Q&A in the Q&A section, and we'll try to get to those as well. But I want to start there just to level set a little bit, because I feel like sometimes I used to always say that as someone who had innovation in my business card, sometimes the biggest barrier was the term of innovation, because it kind of meant so many different things to so many different people. So I guess from you guys' perspective, how do you guys define innovation? How do you think about innovation from the perspective of your company and in your sector and the work that you do? So feel free, anybody can go ahead and take it away.
So I can start
Sure,
in terms of Elianna, why don't you go? Go ahead, and I'll yes and you.
Okay, sure. So I would say there's a number of ways at Visa we hear about innovation, and probably in other industries as well. People refer to digital as innovation. They refer to future forward as innovation, Horizon 3 as innovation. But the way we have really tried to redefine it, both for our innovation team as well as the broader product organization that we sit under, is we are a B2B to C company. And innovation's role is to always be creating, ideating, implementing for that end user, whether that end user is a small business, whether it's a consumer, whether it's a finance professional paying an invoice. Whoever that person is, we're always innovating and we're always creating for them. We're doing it in a new and agile way. And so that's really how we've tried to redefine innovation, from either too technology focused or too digital focused to really being a mindset, as well as a way in which we reach our customers, and that customer base can be really broad.
Love that. So a mindset, and starting with kind of always thinking about that end customer and how we add value to them. Summer, you want to build on that and see how your approach is maybe builds off of, or maybe also is distinct?
Yeah, I think there's some similarities there. So for us as a healthcare organization, we have stakeholders that are very diverse. We have our physician providers that are partners in what we do, and all of us, whether pharmacy, service delivery, clinical, whether that be a behavioral health specialist or a provider of dietitian, perhaps. We are all centered around that member experience and ensuring that everyone has the best resources and support on their health journeys, whatever that looks like, whether it's prevention oriented, whether it's a chronic condition and critical services that are needed. And so our innovation approach really kind of anchors that in the middle and allows us to bring in service technologies, process improvements, true transformational, radical blue sky, up-ins that is going to do whatever we need to help support that individual. And I think that's a really great way that we've been able to build that muscle and that practice of innovation within HCSC.
Fantastic. And Erik, do you want to add anything on to that in terms of how SEPTA looks at innovation?
Yeah, I mean, we sit in a very interesting place in our organization, because we run the gamut from sort of the data practice, which is really trying to infuse the organization with insights and information that can inform data-driven decision making. And we also are responsible for working with business units to translate that information into action. So we sort of have this whole spectrum of things that we're asked to do, and some of it is driven by sort of the innovation agenda that we have at SEPTA, but frankly, some of it is driven by the problems and the issues that are brought to us from other end users, other business units within the organization. And so we really try to be very flexible with the approach that we take, because we're not sure as we go along on any given year, where the priorities are really going to land, given all that's facing us as an industry right now. And so what we try to do is we try to establish a set of principles that we work under, but keep the actual work program and the tasks that we're working on pretty flexible. So we'll work with a business group that comes to us with a challenge, and the agenda for that work will be the agenda that group brings to us. And what we'll try to do is we'll try to infuse the solutions that come out of that with the principles that we've established as an innovation department.
Yeah, what's really interesting about all of your answers is that there's obviously a strong focus on the end customer or member, somewhere in your case, but I think there's also a realization that even with Visa, there's a B2B2C. So there is a broader ecosystem, and you have to partner with the other, lines of business or business units as well. So that kind of, moves me into my next question here is, one of the questions I would get asked, is what do you guys do, as an innovation office? What do you really do as an innovation manager, and so I wonder in your organizations, if you could maybe peel back the curtain a little bit and talk about, that function. How did it even come to be? What are the types of, how did you find your footing on what this innovation function within your organization would actually do? And what are some of the examples of kind of services or day-to-day things that you provide? I know it packed a lot into kind of that one question, but Erik, maybe I'll start with you this time just to see, from your perspective, how has that innovation function within SEPTA grown, and what are some examples of that diverse set of, activities that you guys do?
Sure. Yeah. So as I mentioned, we started our innovation department back in 2015. It was on the heels of the implementation of our most recent strategic business plan. We do strategic business plans on 5-year cycles. We're actually just getting going with our next 5-year strategic business plan right now. But there was a recognition that there was a need for a single business unit within SEPTA to keep an eye on the implementation of that plan, that the plan had been developed, but it was a pretty ambitious plan. There was lots of things in it. We wanted to make sure that we were keeping a track on KPIs, performance management, but they were also moving the needle on all the various objectives and strategies that were in the plan. And so from the very get-go, we sort of were rooted in a sort of a corporate visioning process towards a future that looked more innovative, more streamlined, and with a stronger performance as a business. A good example of a place where we plugged in was right after the strategic business plan was adopted. We were asked to work with our HR department on a 5-year master plan for human resources at SEPTA. So we almost served as an internal consultant on that function and worked with our human resources department to come up with a 5-year master plan, which led to a series of initiatives that, frankly, they had been advocating for and fighting for many years. We were able to package those initiatives and ultimately get them approved and implemented to streamline our HR practices, because we had started with a strategic plan that led to a master plan that led to these business performance improvements.
Sorry about that. I think I had some connectivity issues. So I apologize for missing that. But Erik, thanks for sharing. So Summer, maybe we can go to you next to hear about the story of where innovation, how it's kind of been established, and what are some of the day-to-day activities that you guys end up doing?
Absolutely. So, I think full transparency, right? It may not be the most innovative place that you think of when you think of health insurance and, potentially all that's entailed with that. And that doesn't necessarily trigger or inspire innovation for a lot of people. However, for example, our Texas plan is over 90 years in operation. And so there is an element of history and really kind of continual innovation that we have done as an organization throughout our past. I think probably, about 8 to 10 years ago, there was another sort of refresh in how we looked at innovation, not just as a byproduct, but really something we needed to invest in significantly. And so there is a tremendous amount of work that we have in just bringing new capabilities to bear by way of product and IT. And I think what we've been able to complement in the growth of that function, as well as at the Innovation Lab, is a dedicated team that really accelerates the innovation and the ideas and concepts that potentially our operational partners want to do or try out or test in a much more rapid fashion. And so our team at the C1 Innovation Lab, we have about 100 individuals. And again, just a very multidisciplinary team, technologists, researchers, data folks, clinicians, customer service team members, all the different lenses that we have and functions that we have as an organization that touch and impact our members, bringing them all together with a focus and a deliberative kind of intentionality for delivering that has really accelerated the way organizationally we've been able to advance, because we have a dedicated team. We can take those ideas and partner with our colleagues, test them out, figure out really, nimbly if they work or not, and learn from that as an organization. If you think about your health insurance, most often, right, there's provision of that by your employer, provision of that by the government, or off of the individual exchange, the marketplace, if you will. And so for the last 3 or so years, we have been kind of thinking about the way we can accelerate our pilots and our efforts through employer-based relationships. So, when we're working in conjunction with a large national employer, for example, who has 20, 30,000 employees, we pilot test something, bring it to life really quickly, scale it, and then offer it across our markets. And so that's been an avenue for growth, for change in a fantastic way. We've tackled all kinds of topics. We can talk about that in a little bit, but I think the core of it is just that, dedicated resource, the fact that we're not asking people to just be innovative, but we're behind that in terms of the resources and the function of a team to support that in all areas of the company.
Yeah, it's amazing what you can accomplish with a dedicated and cross-functional team. I love the idea of having people from these different disciplines, which is so important in what we do with innovation. Ileana, do you want to talk a little bit about how you guys came to be, as kind of an innovation function within Visa, and what are the types of services? I know you got into that a little bit with your intro, but could you maybe give us the next sentence or two on that?
Yeah. So yes, ending summer, we also truly believe in our history as Visa. So Visa calls itself the original fintech. And so we'd probably say that our innovation started in the 1950s when we created the very first way to pay digitally. But in reality, our true innovation function started about 6 years ago. And it was really, again, meant to create this dedicated function that looks across the customer journey and is meant to break down silos. And so an example of that would be many of our clients, like issuers and banking institutions, think of different products like credit cards and debit cards. But you as a consumer don't necessarily think of those as two separate products. You just think, this is how I want to pay. You're not deciding or making a super intentional choice all the time on which product is best for me to use. And so the innovation team was really brought in and set up to help break down those silos and say, well, how do we innovate across every way consumers pay, regardless of if it's debit or credit or a commercial card? And so that was really, I would say, the first bit of the intention. The second aspect of that was partnering with our strategic partners. So the original name of our team was Innovation and Strategic Partnerships, and that was very intentional because Visa is very honest with itself. We are not going to innovate the next iPhone. That's not our place within the ecosystem, but we need to work with those partners. We need to work with Fitbit and Apple and Google and Facebook to help them innovate within the payment space. And so it's incredibly important that we're staying connected and understanding what is the next technology Amazon's going to come out with, and then how do we create a good payments experience along with it. And so that piece of innovation is really important to us. And then how that manifests on a day-to-day basis is that we have a portion of our team dedicated to doing R&D, new product incubation for Visa, and we work with the product leads for all the different lines of business at Visa. Again, cross-functionally, design, engineering, product, business, et cetera. And then we said, well, we're really good at that. We can do that really well. We should also be helping our clients. And they're the ones that are implementing these products day to day. We should be what we call co-creating with our clients. And that is really the basis for what most of our team does today, which is co-creation with our clients to ensure that they have a seat at the table. They are the voice of the consumer, they are the voice of the implementer, and they're able to really take the products to the next level and to market, and we're building for the right problems that they want to solve.
Excellent. I love how, even though we're coming from different backgrounds, it's like we're all kind of kindred spirits. But one of the things I see as kind of a good practice that all three of you kind of share is that this innovation function isn't off doing something that's separate and removed from kind of the big picture corporate strategy. But, Ileana and Erik, you both explicitly mentioned, and Summer, you kind of had it implied as well, is that really this innovation function is kind of built into and aligned with, strategy even at the corporate level. And so I think that's a really kind of important point to make sure your innovation function is kind of aligned with that corporate strategy and that corporate ethos. I want to pivot. This is a question we got from actually one of our participant Q&A, but it was also something we wanted to touch on, just even by virtue of the way that we're all talking here today, and what a wonderful service, for the organizers to make this a virtual conference. I'm sure it's not easy. So kudos to all the people on the back end. But, we are in just these unique times of COVID and quarantine and people working from home. And, while, necessity is the mother of invention, as they say, so there's a lot of opportunity for innovation. I also wonder that for your organizations, especially ones that operate kind of innovation lab services, how has COVID kind of impacted your ability to innovate? So Summer, I know you're one of the organizations you mentioned having kind of innovation lab services. How has COVID kind of made things a challenge, but also, maybe giving you some opportunities to do things in a new way?
Absolutely. It's a great question. Of course, one that we're all grappling with. I think, I don't know if it's akin to like riding a bike or skiing or doing something like super exhilarating, where in person we had opportunities to really get that kind of just collisions and thought exchange in a really impactful way. And we all know what that feels like. And so now it's like, okay, how do we get that in this new way? How do we replicate that in this moment? And I think, it has been, we've come so close to that. And it's so exciting to see. I don't know if we're ever going to be exact. I actually think we might exceed it in some ways, and I'll tell you why. Because I think we've been able to leverage things in a different way. So we do a lot of consultative services, for lack of a better word. It's a lot of the customer, client partnerships, elevating and challenging to solve business problems. And again, solutions that drive a better and improved health journey for those that we're directly working in regards to. And so when we do that, we typically have, a constraint, right, around space, around travel, around things like that. In this new environment, we've been able to identify some of the resources and technology and collaborative platforms that really get us so close to that like exhilarating feeling of what we experience in the lab. And then we were able to like cascade that so broadly. So it's really exciting what the challenge of COVID has brought out for kind of our collaborative efforts on the innovation front. But obviously COVID is a health it's a health pandemic, right? It's a situation that is affecting individuals' health and well-being in lots of ways. And so from an innovative perspective on delivery of care and services, we've been able to be extraordinarily nimble in doing things like, creating new open enrollments and quickly pivoting and providing, treatment and reimbursement for COVID-related, admissions or testing. And so it's been incredible to see on the clinical and delivery side, really, really rapid transformations of what we see as a need to delivering. And I think that is something that will leave a footprint in a way that is so positive and so much of what in my opinion, is good to be injected in not only us as an organization, but within the healthcare industry, is that really rapid response. And so, that's one side of it. But Innovation Lab specifically, I think it's about recreating and elevating that opportunity and platform to share ideas and create new solutions. And we've been able to do that. So it's been a journey, it still is, but it's very exciting.
Yeah, I feel like we're all kind of learning on the fly. Elianna, you're another organization that mentioned you have kind of that hands-on experience. How have you guys kind of dealt with managing that in a COVID environment or in a quarantine environment?
Yeah, the way we think about COVID and our experience with it was in March. It was the initial shock. Everything shut down, a lot of projects stopped. But then April was a shift to reprioritize and sort of recalibrate. Clients were thinking about, okay, this is maybe a new normal. How do I reapproach things? How do I rethink things? And then May was really acceleration to drive digital and drive those new priorities. And so we're actually busier than we've ever been. And we have fully pivoted for now to a virtual delivery model. And so our team pivoted to deliver virtual workshops, virtual sessions, virtual engagements. We use tools like Mural, Mentimeter, Miro to affect that. And we're working on creating a virtual innovation experience. So how do we recreate showing Visa's vision for the future of payments, banking, and commerce in a virtual way that is surprise and delight, but also meaningful? And so that's really how we've pivoted and really just doubled down on reprioritizing with our clients. So now the new priorities are, how do we get people going digital and not going to the bank? How do we get people digital and not calling our IVR services? And so we're helping them through those types of projects.
Awesome. Yeah. And just a virtual show of hands. How many people, I feel like everyone I've talked to feel like they're busier now that they're in times of, we're working from home. And yeah, it's crazy how, whether you're in the innovation space or not, that seems to be a trend. Erik, I want to ask you the same question, but I also kind of want to pivot to ask you about institutionalizing some of this, right? So what's changed, over at SEPTA, but also, how do we take advantage of the circumstances and keep the good and institutionalize that? And how are you thinking about kind of innovation at SEPTA going forward into the future as well?
Right. Well, so that is the question. This COVID experience has been sort of fascinating because, on one hand, you've got the entire transportation industry in complete financial crisis. Airlines, transit, even the roads and the highways, without people traveling, gas taxes revenues are down. And so, ridership is way down. And, it's been very interesting to sort of watch how the organization has stepped up to deal with those things and to answer questions about improving cleaning practices and answer questions about what our future trajectory is. And it's been interesting to follow the sort of, the way that decisions are just being made so rapidly. I've spent most of my career trying to craft what I'll call airtight business cases for initiatives, right? Like business cases that nobody can poke holes in. I'll try to anticipate every hole and every person's piece of feedback. And now that we're sort of in this sort of like existential moment, the sort of decisions are getting made so fast simply because they have to. They have to be made that fast because we're facing this crisis. And so sort of what I've started to pivot to is starting to think about ways, as you say, that we can institutionalize what's happening right now. How can we find the little nuggets of efficiency and productivity improvements that we're able to achieve right now because we're in this moment, this existential moment, that, someday, hopefully we're not in an existential moment. We've come out of this. We're on the other side. We're in the post-COVID world. And, trying to come up with ways right now that those can become part of culture, because when we started the innovation department 5 years ago, one of the things that we said was we wanted to advocate for and work to build a culture of innovation at SEPTA. And I think that we're still there. We're still trying to build innovation into the culture of SEPTA. And what I think that COVID represents for us and for the transportation industry is this very unique moment. Yes, we're fighting for our lives, but yes, we're also fighting for a better future for our industries. And so that's kind of the place where we are now with thinking about innovation, is this question of institutionalizing all of the, lack of a better term, all of the good that can come out of a moment like this.
Yeah, that's awesome. I do want to get to a couple of these questions. If we have time, I'd love to circle back and Summer and Ileana also hear from you guys about kind of what's on the horizon from an innovation perspective. But I think this question is important because sometimes for those of us that have kind of, as you guys have all been on that journey, it's also important to think back at what got you there, even, from a day-to-day. So the question we have is kind of, how do you find time to innovate, or how, when perhaps your direct boss or maybe just the other players in the ecosystem, maybe they don't support it, or maybe they think, boy, I don't have time for all this kind of long range strategic innovation type of stuff. I'm busy, handling my day-to-day, whatever that day-to-day is. How do you, how have you guys kind of dealt with that, as I imagine some of you might have, in establishing that function and kind of wrestling, the appropriate resources to even have a portion of your organization focused on innovation? I'll leave that open to anyone who wants to tackle that first.
So, Awais, am I correct? And the question is like how to kind of get going when perhaps there is more support and okay, the front. So yes, that is something I have experienced. I'm sure all of us can relate. I think whenever, so two things came to mind as you were talking through that question. One is that I think it's important to tie, and both Erik and Elianna have spoken to this, but that strategic connection is super key. And I think if there is a component of an organizational strategy or a way that what your innovation, what you're doing, the project you're working on, the pilot, the opportunity, if there is a way that you can tie that to an impact that will be favorable to the strategic direction, that is a great starting place. I think the other thing that came to mind too is, maybe three things. But the second thing was partnership and collaboration. Right? So you can be a voice of one standing on a mountaintop screaming and screaming, but if you have partners, either, they can be formal or informal. But I think when you can have others advocating, not maybe you're the expert or maybe you have the most experience in the room of how to do it, but that others buy into the fact that it needs to be done, or that there is something on the other side that should be seen through to determine, what's next, that is invaluable. And then I think the third thing would be something that I've had a lot of value with personally, is just kind of that, intersectionality, right? And that means so many things. But for me professionally, I think it's been the fact that I've been able to look and see relationships between seemingly two unrelated things and bring them together in a way that yields value. And so that is another opportunity if you're feeling stuck or that there isn't that support, that maybe there's a department that you're not thinking of, or a connection that doesn't intuitively make sense on its face, but is super connected to the work that you're doing, and an opportunity to bring those together in a way that will be mutually beneficial. So that would be my thoughts there.
That's great. And, you actually touched on the question we just got, which is how do we kind of keep our teams in that innovative mindset? And I think one tool that or just kind of one approach that you said is, how do you kind of connect the dots between things that are seemingly unconnected, right? And I think that's just a really interesting exercise, to help just kind of grease the skids on creative cogs. Elianna or Erik, do you guys want to touch on or have any thoughts to add on top of Summer's in terms of how do we just get started and move past inertia and kind of overcome maybe some of the blockers in getting this innovation work started?
Yeah, sure. So just like Summer said, I think we try to think of things like superpowers and what are the individual superpowers of the people on our team. And one consistent thing among innovators is that they can take ambiguity, things that are amorphous, complex problems, and distill them down to solvable problems or solvable solutions. And so I think that showing that you have that superpower is really beneficial and important, especially when people are focused on day-to-day operational aspects of their product. But just as Summer said, getting buy-in and alignment from whether it be your region, your product, your executive is by far, I think, the most important thing. You need to have someone's backing, and it doesn't always need to be the CEO, or it doesn't always need to be the CIO. It could be someone who is struggling with their business and they need help. And so you can have a small win with them. And so I would also suggest not starting with the biggest, most challenging problem there is. Start with a low-hanging fruit, solve it, show that you have impact, and show what you can do, the process you go through, and then start to work your way through the organization to have broader reach and impact.
It's fantastic. I have a couple more questions here that I just want to touch on. And Erik, maybe I'll do this latest one with you because you kind of gives you an opportunity to talk about how you think about innovation and data. We have a question of if you could maybe share an example of data that helped to identify an insight and turn that into innovation and then also eventually into action, right? So do you have an example on hand of kind of how you guys are leveraging data to infuse into that innovation process?
Yeah, in fact, I've got a really good one that we're working on right now. So one of the things we're working on right now, this is something that the whole industry is really looking at, is how do you get crowding or passenger count information into the way that people get their information about when their bus or train are going to arrive. So how do you get into your SEPTA mobile app or your Google app or whatever? How do you get the information about how many people are going to be on that bus so that you can make a determination in your mind whether that bus is got the right number of people on it, whether you feel comfortable riding a bus or a train that's half full or 3/4 full, because we're all trying to protect social distancing right now. And so it's a really interesting challenge, though, because there's all this work that has to be done leading up to getting that single data point into the customer's hands in the way that they want it, whether it's over the web, whether it's in their mobile app, however they want that information fed. We've got to source data from, say, 5 or 6 different sources from across the organization: passenger counter data, fare card data, census data, traffic check data, put it all into a central repository, process it, run statistical models on it, spit something out on the other end, and then provide that information in usable chunks to the people that disseminate, that communicate information to our customers through the app, through the website, through social media channels in digestible ways. So it's this really interesting, pipeline that we're trying to build that starts with, frankly, a whole bunch of data sets that aren't really very well connected, to connect them, which is where sort of the data and an innovation piece come together. And then once they're connected, to communicate them to customers to add value on the tail end. So it's this really interesting thing that we just created this expanded data plus innovation department. And now we have this imminently important project to help our customers feel comfortable riding transit again during a pandemic.
That's really cool. And as someone who's a consumer of public transportation, I mean, I think it's awesome that you're tackling this issue, but also your perspective is not how do we collect that data and then hoard it to ourselves to come up with solutions, but also making that available to consumers and customers to help them make decisions. I have a lot of follow-ups I'd love to ask. I guess we're kind of bumping up against time. So I wanted to ask this last question. It's one that I've wrestled with as well, as being someone who, again, is part of kind of an innovation organization. which is, sometimes when people see an innovation organization within a large company, they say, well, I don't have to worry about innovation because we have those guys and gals over there doing that, right? But so what's the value of having a separate entity versus how do we think about infusing innovation and really that mindset that some of you guys have talked about into the rest of the organization? So it's not just that, hey, the innovation stuff is only done by, the people that have that on their business cards, but also can be done by the rest of the organization. We can infuse that into the culture. What have you guys found to be helpful or even hurtful, some lessons learned in that regard?
For us, we have, there's so many, I'm sure there's so many thoughts around this. And I think we have learned a lot within the Innovation Lab, within Blue Cross. I think, one of the things is that we use human-centered design methodology as kind of a framework. And so it's a transformation of how people think about their roles in the organization as whatever they might be to that kind of first line ethnographic research, right? Our customer service team members are on the phone with members every day. Our clinical nurses are providing care. They're talking to members about whatever they're going through. And so while that might be an operational function, the insights that can be gleaned from those perspectives, it becomes super valuable. So I think it's been exciting to kind of transform and elevate or kind of just make a shift toward a different way of thinking about the operational functions as an input for information for innovation. We partner and collaborate so much that a lot of times our colleagues are, going through design sprints with us or collaborating on a particular project. And if that, is resonant, is successful, is yielding the outcomes that we want to see, we want that to be operationalized, right? So it's something that is like cyclical in that it involves them in providing that delivery of care long term. Because as an innovation team, we want to make sure we're always kind of getting us to that next place, and then allowing that from that to be permeated across the organization. So it really is a partnership every step of the way. But to your point, certain kinds of labels or descriptions of things can alienate people. And so we've gotten better about making innovation like a muscle, a function that's important for all of us to have, and understanding the contributions that everyone makes to that. And then, being there as a supportive team to help dedicate what comes out of those ideas and thought processes so that they don't fall flat. And it's a work in progress, but it's helped.
Yeah, I love some of those examples of kind of human-centered design, some of the methodologies that by their nature are inclusive. Summer, I know you were trying to, Eliana, I know you were trying to jump in. How do you guys tackle this?
Yeah, so I view human-centered design or design thinking as the great equalizer, right? Because it actually trains everyone that they can design and they can be creative, or they don't have to be creative. And so we at Visa went through a product transformation to make sure that that empathy for consumers, that empathy for the end user, to build in an agile way is infused within every product manager at Visa. So a product manager core competency is expected to go out and do ethnographic research. They're expected to work with designers. And the way I also see it is that the best compliment we could get for our work is to essentially build ourselves out of a job. If there's no need anymore for an innovation center, that would be a really big compliment because we've infused innovation within the organization and it's self-sustaining. And so that's the way I like to think about it.
Awesome. Erik, I want to give you a chance just to real quick, if you have anything to add.
Yeah, I think the one thing I want to add is we think a lot about this in the context of empowering employees to have a voice within the organization. We have a 10,000 person organization. It's a very, very large organization. And, something we've been thinking about a lot recently, particularly as we think about the next generation of our strategic plan, is how do we give employees a voice to innovate, to provide ideas, to provide solutions to problems that we're facing, whether it be in response to COVID or anything else. our new general manager, one of the first things that she did when she came in was she created an inbox called GM Ideas. And anyone in the organization could submit an idea, and someone on my team was responsible for making sure that that idea was listened to, followed up on, and acted on if that was warranted. But I think about this, I definitely think about design thinking, human-centered thinking. I also just think about basic employee empowerment and finding ways for us as organizations to give a voice to all 10,000 employees, because we have 10 people in our innovation unit. We can't do all the innovating. We need to find ways of unlocking the innovation potential of all 10,000 people.
That's awesome. I think that's a awesome way of putting it. How do we kind of unlock the innovation potential in everybody, and how can we within these innovation functions kind of help catalyze some of that using some of these methodologies? I know there are, hopefully we got to most of the questions that are on here, but I want to be cognizant of everyone's time. I know that we're kind of at the tail end of the day, and maybe there's some more things for you to get to and want to have some time in between. But Elianna, Erik, Summer, really want to thank you guys. I could go on and talk to you guys for another 45 minutes, if not the whole day, about these topics. And I love sharing some time and hearing from fellow compatriots in the innovation world. So thank you all so much.
Thank you.
Thank you.
All right. And thank you all for joining this session. Enjoy the rest of the conference. Bye, all.